One of the things that we offer here at Grandridge Dental is the ability to change a smile. The color, the shape, the size, whatever the patient wants. We can change the shape and the size through veneers and through other cosmetic procedures. We use a zirconia crown on a lot of the back teeth, which is a very beautiful white restoration. On the anterior, we can fix teeth by changing the shape, the size, the gaps between the teeth, the color of the teeth. Where over 50% of the tooth is gone, we need to rebuild that tooth. We need to bring it back to its natural form. For instance, let's say it's a back tooth and it's got a broken filling in it. One of the things we can do is take the old filling out, rebase it with a new filling, take about 2 millimeters off around the whole tooth, let a lab create and design the perfect ideal crown for that patient, and then have it back within 5 days so that we can put it back in. There are some times that a bridge is a better solution than an implant. Sometimes there's not enough bone. You can get a real good restoration through a 3-unit bridge, and you don't have to do extensive bone surgery on that patient. Sometimes it can be more cost effective and it can be more aesthetic than doing the implant. So veneer is like if you were going to go to re-laminate your cabinet. You didn't want to take the whole cabinet down, you just wanted to take the facing of that cabinet and put a new facing on it. So a veneer is kind of the same principle. If the tooth isn't structurally damaged, meaning there are good parts of that tooth, you can reface that. Veneers are about the thickness of a fingernail, and they're able to create where there's staining, where there's broken teeth, where there's missing parts of that tooth. We can cover that up and make that perfect smile line for you. At Grandridge Dental, we're here to help you. We'd like you to come in, have a free exam, and let's make a decision together about how to properly restore your teeth and your smile.